is it okay to bring a volunteer up? Who wants to volunteer? Okay, we've got somebody in the back row. One of the things that I've heard from a lot of people is that, well, we don't see patients in the clinic. We can't necessarily stop there. I'm going to use you from there. You will get up, but right now we're there. The reality is, how many of you actually see patients in a clinic, or is it like you're talking to the patients in the hallway sometimes? Or do you see them in inpatient? There's a lot of different places that dietitians see their patients and evaluate them. And if it's in the hallway, where sometimes some of our patients get seen, you're not going to get them undressed. At least I wouldn't do that. Okay? Patients probably wouldn't agree. So, when you walk up to me, tell me what you're seeing when she's walking up to me. Walk in your just normal way. Okay. I bet you she walks a little different when you're walking down the hallway, yes? Okay, she's smiling. She didn't walk real fast, but she didn't have very far to walk. Okay? Now tell me, go back to the wall again. If you were an 85-year-old man and had lost 30 pounds, how would you walk towards me? Slow, and you'd probably be bent over. And I could tell just by how he was walking that he probably was not as energetic as she is. That tells me a lot just seeing her walk down the hall. So her appearance, her ambulation, how she carries herself is important. Now, her clothes are not way too big for her. Her clothes fit her. I've had a lot of patients who have lost a lot of weight and they're not willing to go buy some new clothes. And the men have the belt and it's all sashed up and pants are baggy. I had one woman who was very wealthy. And she had these beautiful Chanel clothes. But they were all way too big. So that man who I was talking about and that woman, I said, I don't want to see you until you buy at least one outfit that fits you. Because if every time they look in the mirror, they see this skeletal person whose clothes look awful and they took pride before, that undermines how they feel. So that appearance, just how she would walk here. We said facial appearance. Okay, she was smiling when she came before. I don't see sunken eyes. I don't see temporal muscle wasting, etc. Now you can come close to me, now that we've done that part. Okay, I shake hands with her. Okay? In the old days, women didn't shake hands. I think it's very good that we do just in general at this point. But as part of physical exam, I can tell you she has a good grip. Okay? Now, when you look at etiquette books, they tell you not to grab people back here in terms of shaking hands, although I do sometimes see people doing that. But could I do a sneaky physical exam of what's happening to her muscle mass and whether she's got subcutaneous fat loss here? She just thinks I'm being really polite and nice and cordial, and I'm doing a sneaky physical exam. I can also do the same thing here, and I can tell if she's skin and bones or if she's got muscle mass there. Okay? Now, we're going to come over here. Oh, we can't do it there because, oh, here's what we used before. I'm out of the camera, but that's okay. Let's do this here. Okay? I want you to pretend this is the exam table. So as a doctor, I'm going to help her up to the exam table. Now, I'm helping her, I touch here. Am I helping her? Yes. Am I also doing a sneaky physical exam and finding if I've had muscle loss around the scapula? Or if she's lost a lot of fat? Ah, yes. So what happens if she was in bed and her head is up, her feet are elevated because when she came in the hospital, she ended up having a lot of swelling in her feet, low albumin, okay? She's been up in bed for the last 2 days. Feet look great. Oh, so good. The feet are better. Where's the fluid? Heads up, feet down, or feet up. So lots of times, if you feel in this pre-sacral area, that's where all the fluid went. And sometimes it can be the same kind of, if you push edema on the ankles, it goes in and stays in. You can do the same thing here. Or sometimes when you've had both elevated like this, you can feel that it doesn't feel normal, but you can't even push it in. There's so much pressure in the tissues. Okay, now, I told you that when you shake, you had a good one. There's a thing called the anatomic snuff box right here. If you do this on yourself, or tell your patient, and you push as hard as you can, and you feel that muscle, oh, you can push harder than that, feel mine. That's firm, yes? And so yes, you push as hard as you can. And you feel that muscle there, and it's been shown that that is probably a good surrogate for what's happening to the muscle everywhere. Okay? Now, if I've lost a lot of muscle mass, I either will have very bad tone there, or I may have lost so much that I feel bone underneath. And that really tells you a lot about it. Now, above the waist, your physical exam is mainly more nutritional deficit. Below the waist, if she's been lying in bed, you have disuse atrophy. So this one's a combined down here. This is more clearly related to nutrition. But if I wanted to really understand how strong she was, say she had a really weak grasp, and I thought I felt some muscle problems here. What I can do is I can say, okay, I'm going to push against you. Pick your hands up like this, and I'm going to push. I want you to show me how strong you are. Just push, 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 push. We won't let you go back, but we're pretending that we're push, 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 push. So I can't push back. I can say, okay, I'm going to do this. I can do the same thing with her legs. So I can have an understanding of what's happening to her major muscle groups in the upper extremity and the lower extremity by such simple things. Now, did she do a good job? Was she good to get up here in front of everybody? Let's give her a round. So the reality is, how long did that take me? 2 minutes, 3 minutes? We did a physical exam, I gave a lecture, and we continued on pace. So it doesn't take a lot. It's how you start looking at things. One of the things I mentioned to Harriet, see these little ripples in the slide? That's what it's a kind of subtle thing, but every time we're doing things, it has massive ripples. How you look at things makes a difference in terms of what you see, and that's really what this allows you to do.